Good afternoon. My name is Frank Haney, Winnebago County Board Chairman, and I am again joined by Dr. Sandra Martell, Public Health Administrator at Winnebago County, and Rockford Mayor Tom McNamara. State of Illinois reported today there are now 12,262 confirmed COVID cases, up from less than 100 cases on March 18th. In the United States, as of 3 p.m., the CDC is reporting 347,000 plus cases, up from 9,400 cases as of March 18th. You will get from Dr. Martell shortly the local update on cases, as well as a very thorough update on modeling as it relates to our community. But before that, I do have a couple of items. Last Friday, the CDC and IDPH at the state level revised their position on wearing homemade masks and bandanas. I just want to take a minute and talk about why that makes sense in the short term. This is, simply put, a very critical time in flattening the curve, which really allows us to do something very important. And it's been stated, and we'll state it again today. We want to ensure at the end of the day that those that need help with elevated health care get it. And if that happens, mortality rates stay relatively low, and we're able to help people when they need it and at the level that they need care. Wearing a homemade mask makes sense because you may, in fact, unknowingly have COVID-19. So if across the world to date there's over 1 million cases of COVID-19, all million plus cases started with people having COVID-19 and not knowing it. We do know that studies tell us time and time again that 25% of transmissions occur by people who have no symptoms at the point of transmission. As a result, we have very well-intentioned good people across a range of socioeconomic backgrounds and sectors who are contagious and may be infecting their immediate family, co-workers at an essential business, and accidentally coming into contact with folks at the grocery store or gas station. That could be passed on to first responders, frontline workers, which could have an impact in our congregate settings. So although staying at home and adhering to the 6-foot social distancing rule is still our golden rule in Winnebago County and throughout the state and country, homemade masks are an insurance policy, a short-term extra step that reduces the chances that you pass along COVID-19 if you have it but don't know you have it yet. I would also add very quickly that the preparation of the Emergency Operations Center, our 3 local hospitals who are working together as one hospital system, City of Rockford, the Winnebago County Health Department, and countless public partners are working together preparing for the high point in the curve. It's a point that we hope does not come, but they are doing thoughtful, diligent planning and have been for weeks. Future briefings will highlight some of their efforts, I'm sure. The lives of our residents have temporarily been disrupted in ways we could not have imagined just a few months ago. I want to talk, I'm Catholic, and for those Christians in this community, we are seeing for the first time in our lives that our churches are closed. We are seeing that across faith during the most holy time that we know. That's a big deal. It is no small thing. I would also note that at a time when government partners and community leaders are asking our folks of faith to stay home and to practice their faith in a different way in the short term, we also have many religious leaders joining that call across faiths, and we do appreciate that in this unprecedented time. It reminds me of the Bible quote, Matthew 18:20, "For where 2 or 3 gather in my name, there I am with them." We have the opportunity this week and in the coming couple weeks for those of us of faith to double down on the faith that we had learned as children and adults. We have the opportunity to put that faith into action in terms of how we go about pulling together as a community, helping people where we can appropriately, and making a tremendous difference because of that. We talked last week that we are our brother's keeper, and there has not been a challenge, I think, that has faced our community, our state, or our country where that is more true. Our actions affect other people directly. So please take the restrictions that you've heard time and time again as seriously today as you ever have. And if it has been a slow go to this point, this is the time. This is a critical time in the process. I just want to touch very quickly on this idea that there's a push and a pull between two very important COVID items. One is the public health aspect, which is real. The other is the economic impact, which for many people, unfortunately, is very real. In the short term, I still believe that the best economic strategy for our community and for our state, for our country, is to stop the spread of COVID-19. The restrictions put in place by the governor, it is the right course, even though it is difficult and nobody likes it, including myself. We need to be all in for Illinois, and here at home, as we have been when it counts in the past, be all in